And again, that was CGTN's Su Xiaoxiao reporting. Okay, let's get to our panel. Joining us now from Beijing is Einar Tangen. He's a current affairs commentator for CGTN. With me here in the studio is Eric Ding. He is an epidemiologist at the Harvard Chan School of Public Health. Also joining us from Santa Barbara, California is Thomas Tighe. He is the CEO of the medical humanitarian relief company Direct Relief. And from Orlando, Florida, we are joined by Terry Lyles. He is a psychologist and stress coach. Welcome to all of you. Einar Tangen, let me start with you. As we just heard in our report, more than 900 people now killed by the virus, mostly in China, 40,000 infected, also the majority in China. Can you give us a sense of the mood in the country right now and the impact that President Xi Jinping's visit had to this hospital in Beijing?
Well, let me start with Xi Jinping's visit. I actually live in Chaoyang. The hospital he visited is just down the street from me. I think this is a good sign. I mean, Xi has stayed out of the limelight to make sure that all efforts were focused on the virus itself as opposed to any kind of political posturing. But this was seen as a very good sign from the political leadership that they are actively involved. So that was the good news. The bad news is the death toll continues to rise. On that front, though, staying around that 2% in terms of mortality is very, very important. You're seeing the numbers rise, but the infections themselves have not progressed geometrically. They seem to be just going up slightly. That indicates that we might be near a peak, and at that point, you can have containment.
Well, the president was very confident, Einar Tangen, that this outbreak will be contained. As he said, it will be overcome. That must be of some, I guess, building some confidence in the country.
Absolutely. I mean, people need to be reassured. Right now, the greatest danger is fear and panic. You see this on social media. There are so many very odd conspiracy theories and just completely wrong facts being not facts, just wrong ideas being spread around. Luckily, if you go on the street itself, you'll see that people are very, very calm. People are sending messages to each other, just, be safe, don't go out, obey all the kind of dictates that the government has given in terms of keeping yourself healthy.
Eric, the death toll continues to rise. The number of people infected, that also continues to rise, most of them still in China. What do you make of efforts so far to contain the virus? I mean, are we getting close to maybe a peak?
I'm not sure if we're reaching a peak. First of all, the Hubei province provincial government says they're at a maximum capacity of 6,000 testable lab runs a day. And we're diagnosing over 3,000. Basically, it's rising in a very narrow band, which means it correlates with their testing capacity. I'm not sure we're reaching a peak yet. If you think about the number of cases, for SARS, it took 3 months to about 8,000. We did that in just less than 1 month. As for mortality, it took SARS 9 months to 800. We hit 800 a couple days ago in less than 6 weeks. So this virus is going up really, really fast, and there's building evidence that it can transmit even when you're asymptomatic, which is a very difficult problem for containment. And we're seeing now outbreaks in Hong Kong, Singapore, in Europe. The 5 cases were in France were linked to the Singapore Business Conference. So it doesn't seem like it's stopping.
Asymptomatic, you say, those are people not showing any symptoms of having this virus. How difficult does that make it for those people carrying out tests? I mean, you may have the virus, but you don't go and get tested.
Exactly. And this what makes containment so tricky. Like, for example, in SARS, we were able to contain SARS even before the vaccine arrived, because SARS was only contagious when you had symptoms. So if you got off a plane and you get sick 2 days later, you don't have to hunt down everyone on the plane if you were still sick, if you were still healthy while on the plane. This is also what makes the cruise ship that's parked off of Yokohama, Japan, so tricky. Princess Diamond cruise ship, 3,700 people on board. They tested 438, 136, which is 1 in 3 people that they tested came back positive for the coronavirus. Interestingly, these 136 are being treated in Japan, but only under the condition that Japanese government says these are not Japanese cases. But that 136 on
Why is that? Because the ship's offshore?
The ship's offshore. It wasn't diagnosed within Japan, and Japan wants to avoid any panic with the upcoming Summer Olympics. So, but this 136 petri dish on this cruise ship is the largest epicenter outside of China, and it's asymptomatic transmission and lots of close contacts. So that's what makes it so tricky.
Okay. Thomas Tighe, tell us about Direct Relief and your efforts to help contain this virus and stop the spread. You are working now directly in Wuhan as well, I understand.
Right. It's unusual for Direct Relief to receive requests from China. China is a wealthy country. It has plenty of capacity. But as this has unfolded, we do have a private stockpile that we prepare for incidents like this, if not this scale. And as a nonprofit, non-governmental organization, we can typically move pretty fast if there's a need. So in this case, we were put in direct contact with Wuhan Union Hospital. The medical staff was concerned about its supplies running short. So for us to make sure that we had inventory that was suitable and then work through the logistics channel to make sure that we could get it to them with the permission of the Chinese officials. Thankfully, FedEx, which has a large footprint in China, 8,000 employees, they were kind enough to step up. Once we received an order that we could fill, they took it free of charge and flew it over there and delivered it right to the hospital.
Yeah, we were just looking at pictures of some of those shipments getting through. What are the main things that you are getting to Wuhan?
Mainly the requests were for surgical masks, N95 masks, other kind of protective equipment that we had stockpiles of. So that was the hot commodity that was heavily requested. And we fulfilled all the requests that we had. That in turn led to other requests from other facilities, other referrals. So we've been trying to keep up while drawing down on a relatively small supply given the size of the demand. So I think China has both the largest need for things like the personal protective equipment, but also has the largest capacity in the world to produce it. So we're trying to reserve some of the materials here there's 6 cases in California. We've also been able to supply some support for the quarantine patients here in California, but there's concern about, as the doctor said, how it will play out in making those scenario projections and what is the best thing to do. For us, it's protect the health workers first, the infection control in the places where it's most likely to be picked up, and then do work at the behest of the public health authorities to see what private organizations like ours can do to help.
All right, let's bring in Terry Lyles. Terry, this virus impacts people in so many ways. Of course, there's the health impact, but there's also the impact it's having on the economic life of China, on the social life of China. It impacts people in so many ways. One of the things that we haven't heard about and haven't talked about very often is the psychological impact it could have on people. I mean, we heard Einar Tangen tell us earlier on, the president's visit to this hospital in Beijing was aimed at stopping any kind of panic in the city, in the country, etc. What kind of psychological impact would an outbreak like this have on people?
Well, I mean, we're seeing the effects of it now, and I think SARS was mentioned earlier with one of the panelists, and the SARS process. I mean, my wife was the Cheetah and Lion King in Toronto, and they shut the entire Broadway show down in 2004 because of it, and it was a scare. It wasn't even real. There, but it was a perception, and perception becomes reality 90% of the time. So I think we in the media have to be really careful to state the facts, but yet also mitigate the line of what is happening and what could happen, and not overexpose it, but yet be real, because people respond in fear and panic, unfortunately, in a lot of cases. And I did work at Ground Zero after 9/11 and the tsunami, Haiti earthquake. And we see over and over and over again that those events, when it happened, it was over. And then there was a recovery process. This is still in the active process. So there's a lot of fear and concerns not knowing what's really happening. And as more cases are potentially coming to the United States, a little at a time, people just don't know what to expect. And I think we have to be really, really diligent about how do we convey that information, but yet how do we interpret those processes that are coming out in the information. We use a recovery manual that we've used in all these disaster reliefs. It's on terrylyles.com. It's a free PDF download, and it's basically, how do you get through something like this? The fear, the anxiety, the intrepidation of what if, because we can drive ourselves crazy wondering what we're doing. We have to go back to basic hygiene. Stay clean, wash, make sure we're not rubbing face, eyes, nose, and just do the basic things we teach our children, but also know that things can happen, but we can't worry about things that can happen. We have to go about our daily lives, but yet be vigilant about what is real.
And I guess what must be contributing to some of the anxiety in an area like Wuhan is what you just mentioned, the fact that we know very little about where this virus originated, how it spreads, how far it's going to go.
Well, and I think that's where the information, people are hanging on to that, and I really feel for the Asian population, you know, of people that are flowing in and out. And I have an Asian American friends that are here that are doctor friends of mine and just family friends. And there's also another element that a lot of people aren't talking about. There's this issue that if you look Asian American, you could almost be, you know, prototyped as what if you are a carrier? And it's so out of the box because there's a lot of people here that have not been to Asia in years, much less China, but yet there's this fear of, you know, stamping someone as potentially in a virus issue. And so there's all kinds of social, economic issues around this, but there's also the basic stress level of we have to be very careful about how much we share, but yet get the right information on. That's why I think it's great that you got the panel on you do today, that we can share real information, keep it out there, keep people abreast of what's happening, but yet not share the panic, but share in the vigilance of let's be smart, let's be diligent, let's be vigilant, even in wartime. This is a different kind of war. It's a virus war, and we just have to be vigilant.
You know, Einar, listening to Terry there, this has also morphed into a political issue as well. Here in the United States,
Yes.
Politicians are accusing China of not being transparent enough about the spread of the virus. There are also tons of rumors circulating about the virus. A lot of this, of course, is amplified because we now have social media, and that spreads things exponentially quickly. The Chinese ambassador to the United States, Xu Tiankai, he was on a U.S. television program over the weekend, and he pushed back on some of these rumors. Let's listen to what he had to say.
I think it's true that a lot is still unknown. And our scientists, Chinese scientists, American scientists, scientists of other countries are doing their best to learn more about the virus. But it's very harmful, it's very dangerous to stir up suspicion, rumors, and spread them among the people. For one thing, this will create panic. Another thing is that it will fan up racial discrimination, xenophobia, all these things that will really harm our joint efforts to combat the virus.
So, Einar, as we can hear, you know, this is having all kinds of effects. Is China getting the recognition, though, that it's doing all it can to combat this outbreak and its spread? It's put an entire region, millions of people, tens of millions of people, under quarantine right now.
Well, I don't think there's any question that China has created the gold standard for, you know, reacting aggressively to this kind of virus. We know that this is probably, well, I shouldn't say we know if I'm saying probably, but it seems to be a cross-species jump of a virus. Nature has published its findings that they think it's pangolins, things like this. But, you know, the issue here is common sense. Unfortunately, it is very, very bad when you have nations like the United States who are in essence giving oxygen to all these kind of conspiracy theories and things like that by overreacting to these issues. The WHO, which is, you know, not controlled by China by any means, has made it very clear that you know, the U.S. is overreacting. They said you don't need to cancel all these things. You do more harm than good by you know, putting up these barriers and effectively trying to hem people in. So at this point, you know, the Chinese, as people that I've talked to, feel very negatively about the U.S. And this is going to have a long-term psychological impact because they believe that the U.S. is kicking China when it's down. That instead of supporting and trying to create a rational argument of how this can be controlled and, you know, assuring people that it will be, they're making more of it seem like it's, you know, nefarious, that this is an opportunity. You have an administration official say, oh, this will bring jobs back to the United States. This is the kind of thing that you don't want.
Eric, Anna just mentioned the World Health Organization, the WHO as it's known. It now has a team on the ground in Wuhan, and the Director General of the WHO says the organization is working closely with countries all around the world, especially countries in Africa. And as we're fully aware, China has about 1 million workers in Africa. There are a lot of African students who study in China, both these groups traveling back and forth. Let's listen to what the Director General of the WHO had to say. Let's watch this.
We have now identified 168 labs around the world with the right technology to diagnose coronavirus. We have sent kits to Cameroon, Cote d'Ivoire, DRC, Egypt, Ethiopia, Gabon, Ghana, Iran, Kenya, Morocco, Nigeria, Tunisia, Uganda, and Zambia. Many of those countries have already started using them.
So what is the WHO doing right now in China?
I think WHO is, because they sent their own team to collect data on symptoms and incidence rate, I'm very encouraged by that. At the same time, I think we might also get better clarity of the precise incidence, severity, and how many cases are being missed. Because there's a lot of cases in China that's being missed as the milder cases are being turned away because of hospitals being overwhelmed. And recently, just today, China announced that it's changing its diagnostic criteria slightly, that if you test positive but have no symptoms, they will no longer count you among the confirmed cases, which is quite eye-opening. And so I think what WHO being on the ground will give us more confidence once they have much more comprehensive numbers on how many cases there are. And that gives us much more confidence of case fatality, transmission, induction time, and its potential spread to other countries like Africa and Indonesia, which I think hasn't been enough testing.
Insofar as the capacity to treat people, Eric, those 2 new hospitals were built in Wuhan. Those hospitals were built within less than 2 weeks. Are they making a difference?
I think for severe cases, quarantining them, I think it is making a treatment difference. There was Anthony Fauci, when he was commenting that 1 in 4 cases in the previous Wuhan hospital had to go to the ICU. And it's, if anything, it's not the number of cases, it's the number of people in intensive care that's the most straining on any healthcare system.
Yeah.
And no hospital in the world, if they had this kind of incidence in China, can handle 25% of these severe cases in the hospital ICU. No country's healthcare infrastructure can handle that. So I think that is actually more concern, because there's situations in which cases have disease for 3 weeks or even more. Because think about it, if only 8% have been recovered, 2% have died so far, that means 90% of the people have not resolved into either death or recovery. They're still in the ICU, still in the hospital, and that is what's scary for the healthcare system.
Thomas, looking at the efforts of direct relief, are you focused only on the Wuhan region or Hubei province, or are you working in other parts of China as well?
Well, we've started to receive requests from Chongqing. We've responded to those. I think, again, trying to keep it limited to the limited supplies, how they're apportioned and to whom they go. I think the focus has been on the health workforce so that they're protected. I think I'd like to also just mention, I think we've been very keenly sensitive to just the fear that we talk about cases and transmission rates and deaths and statistics, but behind these are a lot of people. And I think what we've seen is we've done everything, just an enormous expression of gratitude for something that is relatively modest, but I think it's been a sharp reminder that it's a scary situation for millions of people. And it's important for them to know that there are people outside of China who are concerned for their welfare, as we are. I think so. I think that signal ought not get lost. I think everyone's rooting for China right now, both for the obvious public health emergency they have, but also because there's millions of people living in fear. And when we were talking to the doctors at Wuhan Union, this is on top of what always happens. There are still children being born in Hubei province. There's still people who get sick and hurt and need to go to the hospital. So I think to try to manage a whole set of new events on top of a pre-existing set of events, it requires a rapid adjustment from everything from testing to diagnosing and case tracing and everything else. So I think as a humanitarian organization, we're trying to maintain the focus that there's, as Terry had said, I think the strong social element that will ultimately be very important, as well as now that it's important to express concern for people who are living through a very scary time.
Terry, what are your thoughts on that?
Yeah, I totally agree. I mean, I spent a month in Thailand after the tsunami, and, we were recovering bodies, but, that was containable because, there were about 6,000 bodies in this one province. But the event had passed. And I think the scary part about this is this event is ongoing. It's a tsunami that keeps surging and surging. And I think we have to keep the messaging out there that we don't know everything that we would like to know, but we just have to be diligent about what we do know. And as was mentioned, I mean, you think about these hospitals and the Chinese government, this is not political. I mean, this is a health crisis. This is global. We live in a global community now, and people travel all over the world on a daily basis. And I think we just have to really be diligent enough to say, look, I have to take care of what I can control, control the controllables, as we talk about in the performance world. And how do we do that? I got to take care of myself, my children. If you are exposed, get treatment immediately. But for people that are there, the doctors, the nurses, the care people, I mean, God bless them. I mean, they're putting their lives in harm's way every hour of every day to treat these people. And we really just have to put ourselves in those positions of empathy and say, if it were here, what would we do? How would we respond? There should be great humanitarian effort going toward China and helping them in this process. I believe we could help sustain that and eliminate some of those fears, because sometimes dealing with fear or depression is about movement. And the more we can move into the situation and do something about it versus just be fearful and back up, the better we are.
I know something else that is being looked at, and that is the economic impact of this coronavirus spreading. We know that in many places in China, the assembly lines, the supply chains have come to a standstill. And we see that, it's having a significant impact on economic life in China. And I'm just wondering whether down the line this could have a global impact as well.
Oh, I think it
Arlen,
will.
if you start looking at what happened in 2003, you'll see that there was an impact initially in terms of the export trade, but it caught up at the end of the year. Actually, there was a full point of growth that China went from 9 to 10% growth during 2003, despite SARS. But things have changed dramatically. China is 4 times large, its economy is 4 times larger now, and it's much more balanced towards consumption. And unfortunately, consumption is not something where if I don't consume something today, I'm going to consume twice as much tomorrow. The next factor is keeping people employed. The consumption is going to depend on people having wages and things like this. And this is an area where the Chinese government has been reacting very, very swiftly. They've set in motion a full set of loans, ability for companies to have to issue bonds, cutting any kind of import tariffs on anything that is related to this sickness, and making sure that there's enough liquidity in the system. And I expect they'll do more in order to stimulate demand to try to keep things on an even keel as the year goes forward.
Eric, I want to get back to something you mentioned a moment ago, and that is the proportion of patients who are now deemed to have been cured. We have a figure of 8.2%, and that's up from 1.3% on January 27th, which wasn't that long ago. Those are figures that have been given to us by the Chinese National Health Commission. What do these figures tell us?
It tells us that even despite so many cases, we've had 40,000 cases, 30,000 of them were diagnosed way more than 3 weeks ago, that people are still sick. The 90% of the cases have not resolved, which means they are still sick with symptoms. They still have a viral load. It means they're still shedding viruses. And that means that these people are literally sitting in the hospital for that long. And without a true resolution, are they sick? Are they getting worse? And this is why this is going to strain the healthcare system. The fact that these people are sick for 3, potentially 4 or 5 weeks, no healthcare system can easily handle that. And that is what the main concern is. Because during this time, people are infectious if you don't have good containment.
Okay, and we are going to have to leave it there. Thanks to all of you for being with us. That's it for this edition of The Heat. It's been an informative discussion. We'll have more in the days ahead. I'm Anand Naidu in Washington, D.C. Thanks for watching. This week, we launch our own podcast. You can listen to it through Apple Podcasts, Google Podcasts, Stitcher, and Spotify. We'll be covering stories from around the world, similar to those you see on this program, but we'll get a bit more personal and candid with our guests and correspondents. So if you're on the go, whether on the train, driving to work, or just out for a run, give us a listen and make sure to subscribe. Search online for CGTN and The Heat Podcast.